Good morning, all. 2 days ago, we announced a series of community-level strategies to help slow the spread of novel coronavirus in Minnesota communities. The broad set of recommendations we made then remain in place until further notice. Each one of those policies is designed to make person-to-person transmission less likely by reducing close contact interactions. The full set of recommendations is available on the MDH website, but I want to repeat them right now. It's important to cancel or postpone gatherings with 250 or more people, which includes concerts, conferences, professional and amateur performances, or sporting events. Equally important, to cancel or postpone smaller events, those with less than 250 people, that are held in settings that do not allow social distancing of 6 feet per person. And for those of us who are frequenting bars and restaurants, it's really important to monitor our own behavior to try to achieve social distancing in those places that are open, and we want them to remain open as long as possible, but to do that in a way that is mindful of the importance of social distancing, even in those venues. And it's very important to limit attendance to smaller groups of people. We recommend less than 10 people for meetings or events where the majority of participants are at higher risk for severe illnesses from COVID-19. So that applies to long-term care settings and residential and care settings for people with disabilities, for example. We strongly encourage people who are 70 and older, regardless of their health status, or people of any age who have any of a number of underlying medical conditions that put them at greater risk for having a severe reaction to COVID-19. We know that's a minority of the population, but for people in higher risk groups, it is time now to take this guidance to isolate yourself and to really pay attention to those social distancing recommendations and really to reduce the amount of interaction people at higher risk have with the outside public. There's no doubt that these recommendations mean inconvenience and disruptions for many, but we all need to do our part to slow the spread of COVID-19 and protect the most vulnerable.